a coffee with a friend or something. Not you
Yes,
don't look like
please.
you're about to.
Later, let's have tea in my garden.
Yes, yes. So welcome everyone. It looks like so it's a little bit after 10, but maybe we'll wait another minute for people to start coming in and join, and then we'll get started. Thank you for the panelists who signed in early and kind of get everything set up. So appreciate your time. All right, we can go ahead and get started. So I'll be your moderator today. My name is Chang Huang with the Childhood-Led Poisoning Prevention Branch, as you know, and I'm very excited to be here with you all today, and thank you for joining us. We're thrilled to kick off the last day of our series, which focuses on childhood-led poisoning prevention for EP. And grateful to have our presenter with us here today, and who'll be sharing best practices for environmental professionals for collaborating with local code enforcement agencies, conducting proactive rental inspection, and collaborating with local community experiencing environmental injustice. And I'll be introducing the presenter in a little bit, and we'll get started. But first, I want to provide a few logistical details for using the various features for our WebEx event today. To minimize the potential for background noise, everyone will be muted during the session. But as you know, feel free to use the chat feature or the Q&A feature, which can be found on the bottom right-hand corner of your screen. And if you need this meeting to be translated, you can choose to translate the conversation in real time from English to one of over 100 different languages. Not sure if you will be needing this, but we want to provide and put it out there that it's available for you. And at the bottom left corner of the screen, you can find an option to turn on the caption and highlight, and you can also select from a drop-down menu a list of languages. Again, don't anticipate that anyone may be needing this, but it's there for you as an option should you need it. And please let us know in the chat if you need assistance in accessing this feature. And please note that this meeting will be recorded, and you'll be able to access a copy of the recording on our website in mid-November. And so today, webinar presenter, we have Tom Paris from Los Angeles Childhood-Led Poisoning Prevention Program. We have Jennifer Forrester from the Orange County Childhood-Led Poisoning Prevention Program, and Karen Yu from San Francisco Childhood-Led Poisoning Prevention Program. And I'll just go briefly overview of what these three presenters will go over today. So Tom will be providing an overview of the LA CLIP work around code enforcement strategy through the Enhanced Lead Hazard Awareness Project. And Jennifer will be discussing their collaborative community engagement work to address lead-contaminated soil in Santa Ana through the Lead in Soil Roundtable. And finally, Karen will be describing their proactive inspection work in San Francisco CLIP to identify and eliminate lead hazards. And feel free to ask any questions you may have during the presentation in the Q&A, and we'll be making some time at the end for question and discussion. So with no further ado, please join me in welcoming our presenter from our webinar session today. I'll go ahead and hand it over to Tom.
Okay, here we go.
Thank you, Tom.
Oh, ready to start. I am Tom Paris. I'm going to tell you about our Enhanced Lead Awareness pilot project, the process we took in developing it, and our results and success. So first, I'd like to recognize the leadership in environmental health in Los Angeles County for allowing this project to go forward. And I'd especially like to thank Scott Abbott, the district manager of the branch that oversees housing inspections in Los Angeles County. He's the one who came up with this idea. His thought was, next slide, please. His thought was, how do we improve the housing inspection process to provide an increased awareness of lead hazards and better serve our community? And from that kernel of an idea, we developed a pilot project and just start running with it. So next slide, please. So the first thing we recognized, we needed an educational component. So we first thought, okay, we'll have every inspector become a certified lead inspector assessor. Like that idea, but you know, there were a lot of problems with this idea too. It was going to require a 40-hour training for these inspectors. We targeted 10 inspectors for this pilot project. So what we would be doing would be taking away about 400 hours of inspectional time for them to complete this. And you know, let's say they were inspector assessors, then it'd be great. They'd be able to test for dust and soil, and you know, they know everything about you know, lead and lead hazards. They'd be able to interpret results. But you know, they have that 40-hour training. They'd also have to take a certification test. And at that time, the certification tests were only twice a year in Southern California. And so they were on weekends, they were not in our county. So now we're talking about overtime, overnight stays, and then we don't know if they're going to pass the exam because there's like a 20%, 30% fail rate on this. So we discarded this idea and we found instead something that for us worked a lot better, and that was the EPA's RRP training. Now, this is a one-day training. It's the EPA's Renovate, Repair, and Paint training. It's 20% of the cost of the inspector assessor training. It's the minimum lead education that's required for plumbers and carpenters, painters, handymen who disturb paint. So it's consistent with, it's what they need to know to be vested to do these inspections. And it's also consistent with the recommendations of code enforcement throughout the state. Code enforcement officials are asking their inspectors to have this training. So we thought this was a great way to go. But we didn't want this RRP training to be a educational one-off. So we decided we'd have another layer of lead education, and we chose HUD's visual assessment training for lead-based paint. This is a wonderful training. It's a 1-hour training. It's interactive. They're going to ask you questions along the way, question you about lead. You're going to reaffirm what you know about lead, pick up some new concepts along the way. It's really wonderful. I would recommend it for anybody who's an inspector. But now we have 2 layers of lead education, and I thought one more would be fantastic. So I developed a 3rd layer, a 3-hour lead education, lead awareness class, provided continuing educational units for the inspectors. And in this class, I went over, what's lead, what are lead hazards, what are unsafe lead work practices, lead funding in Los Angeles, because there's a lot of it. So landlords have to make repairs, there would be funding available. And really, what was their role in this lead awareness pilot project? So now we feel pretty good. We've got an educational package set up. And now we want to go to, I'll take the next slide. Now we have to decide location. And we are Los Angeles County. We're a very large county. We go from the beaches in Malibu and Santa Monica across the San Gabriel Valley to Pomona. We go from a hilly desert area in the north all the way to San Pedro. And we have a lot of different socioeconomic zones within our county. We're not looking to do our inspections in Malibu or Bel Air. We wanted to go where we had families that were low income, that we had children under 6, who were lead poisoned, high risk zip codes identified by the state. We wanted, these housing built before 1951 if we could. So we looked at many areas of Los Angeles County, and we kind of kicked around a lot of them. And we kind of focused on 2. We looked at the Boyle Heights area of East Los Angeles, and then we also looked at the Florence Firestone area of South Los Angeles. Next slide, please. We looked at these areas and we settled on the Florence Firestone area. The Florence Firestone met all these criteria. It had the median income of folks well under 20% for Los Angeles County. We had kids that were lead poisoned, and there were a lot of kids in this area. It had all these criteria, and it had one other factor. It had a great chief. Cassette Strasberg, who's the chief of housing in that district, was a former CLIP inspector. So she's a great lead educator. She's a great public health official, and honestly, just a great person to work with. So here, we felt very good. We had, we're assembling something that we knew was right, and I think anybody can see that you can assemble the greatest pieces or design the greatest projects, and if you don't have the right person administering it, it's not going to go forward well. We knew we had the right person, and that was Cassette. So now we have our education, we have location. Now we have to think about, what are we going to say? I'll take the next slide, please. So we developed a script. And this script was specific to preventing lead poisoning in children. We had an introduction that stated our purpose, and we developed questions. Do you have flaking paint? Do you have children under 6? Are you aware of lead hazards and how they affect your health? Are there doors and windows that don't open easily or close easily? Do children chew on any painted surfaces? And then just, something that's unique for these inspections is, can I start my inspection in the child's bedroom? So that's totally different. So I'll take the next slide. That was our script. I'll have one more slide. So now we have something to say. We also have to think about, how are we going to say it? Because we have an area now that have many people who have used English as their second language. So we had to communicate our ideas to them, and we had to, find a way to just get our most basic lead concepts to them. So we had our script, and we had everything recorded in Spanish. We had each inspector install Google Translate on their phones, county cell phones. And with this ability, we were so much closer into just communicating our important lead concepts to them. And then we also had our pamphlets that were in English and Spanish. So we're finding a way, now we have something to say, we're also finding a way that we can say it. So next slide, please. So now we just have to make sure we're uniform in how we go about our inspections. We want to make sure we're going about things the right way. So we developed procedures and we developed a checklist. Did you see flaking paint? Where'd you see it? Did you take photos? Did you schedule a reinspection? Did we give out pamphlets? How many were provided? Did you contact CLIP, our program, if they saw unsafe lead work? I'll take the next slide. So that was our field inspection checklist. I'll take the next. So now we're ready to launch. We have our education, location, we have something to say, we have a way to say it. We're uniform in our approach. We're ready to launch. We started our process in July of 2019. We finished our training and everything, and it's now mid-February 2020. And I think everyone knows that within 1 month, all housing is going to stop because of the COVID-19 pandemic that affected the world. So we luckily were able to get inspections done, and we got about 70 apartment units at that time. So we're really happy that we were able to, go ahead with our project, at least in a small measure, smaller than we wanted, but we got that out. So before I give you the results, there's one other thing I wanted to say about this Florence Firestone area that I think is very important. This was not a neglected area. This was an area that had received inspections on each of the 2 previous years. So it'd be so like someone who wants results to say, oh, we have a place that hadn't been inspected for 5 years. Let's send these finely tuned out lead inspectors out there to take a look at this and look. Well, 100% of the places have lead hazards. What great work we do. No, what we wanted to do is we wanted to see what was the increase and what was the improvement in finding lead hazards during apartment inspections where they have been going in each of the 2 previous years. And the results were dramatic. There was a 17% increase in units found with exterior flaking peeling paint violations. There was a 45% increase in properties with exterior peeling paint violations. Not only were they finding more violations, or were they finding these violations, but they were finding them and detailing them in more locations. So they're now able to see these, and they're seeing very clearly in many locations generating these violations. But one really great benefit, one really great aspect that would never have been done with housing inspections or hadn't been done before, but it was a true benefit for protecting children, is we had 48 tenants with children under 6 now aware of lead hazards who stated before they weren't. So now we could just better protect our Los Angeles community. So like a lot of things, the COVID-19 pandemic stopped short. This was one of them. The great thing is now we have 10 trained inspectors who are going to carry forth with that education and their experience for the rest of their housing careers. And take any questions.
Great, thank you so much, Tom. We can open this up for any questions that people may have for Tom after his presentation. Okay, so looks like there's no questions, and so we'll go ahead and move to Jennifer Forrester, and I guess we'll do a question at the end and discussion. Okay, sounds good. Thank you, Tom.
My pleasure.
Good morning, everyone. Thank you for having me. My name is Jennifer Forrester, and I'm a supervising environmental health specialist at the County of Orange Environmental Health. I also oversee the environmental professionals on the Orange County Childhood Lead Poisoning Prevention Program grant in Orange County under the healthcare agency. And today we're just going to go into the Lead and Soil Roundtable, what that is, how it was forged, and how that is going to move forward in shaping the city of Santa Ana as a community, and how those community members will benefit for years to come, hopefully. Next slide. So I wanted to give a little bit of context or background as to, in case those that might not know where environmental justice is kind of coming from and how that's shaping things moving forward for cities and counties. So it started with SB 1000, and that is the Planning for Healthy Communities Act of 2016. And this was signed into law in September of 2016, but did not become in effect until January 1st, 2018, where cities and counties were required to look at or adopt environmental justice elements into their general plans or policies, objectives, and goals. And this would happen when when 2 or more general plan elements would be changed or updated. And so what this means for cities and counties that update public policies was that they would need to look at their disadvantaged communities in order to reduce 3 things, and that is reduce unique or compounded health risk, promote civil engagement in the public decision-making process, and 3, prioritize improvements in programs. Next slide. So what is a disadvantaged or EJ community? So this is a combination of 1, disproportionately affected areas by the environmental pollution or other hazards that can have negative public health effects, exposure or environmental degradation in a community, and 2, having concentrations of people with low income, high unemployment, low levels of home ownership, high rent burden, sensitive populations, and low levels of education attainment. So I do want to highlight too, because this is going to shape into some things we bring up next in the next few slides, is Cal EPA also identifies advantaged communities, and that's per their section code 19711 as low income areas that disproportionately affect by environmental pollution and other hazards, as we mentioned. So that could include air, water, and soil. Next slide. So in partnership with Cal EPA, California State of Office Environmental Hazards Assessment, or also known as OEHA, had developed a screening tool for folks to use, and it's called Cal EnviroScreen. So this was adopted, and it had a couple of different drafts. Right now they're in current draft 4.0, and this was presently used when assessing the communities of the Santa Ana. And so it was noted that this method would identify the communities by the burden of pollution, and then in addition to the disproportionately vulnerable populations within those communities. And so this tool, I believe, was introduced to CLIPS as well, and has been useful in targeting outreach and a number of other objectives and actions within our scope of work. And so what I wanted to point out is that there are currently 23 environmental justice census tracts that are highlighted in magenta that overlap with the city neighborhoods that are in gray. And so these city areas or EJ areas are noted in the PowerPoint slide here. And so these are going to be, 23 is a lot. And so this is by far the largest amount of census tracts within Orange County, within one city. And so this became a great opportunity for our team to move forward in this collaboration. Next slide. I also wanted to highlight, right, because we are a childhood lead poison prevention program, and this was brought to the table as well when we looked at housing, an older housing stock within City of Santa Ana. And so this tool also comes from the Cal EnviroScreen 4.0, but it allows us to look at children's lead risk from housing. And this uses two different areas to create a percentile within those census tracts. And so it's looking at, again, as I said, older housing stock that are more likely to have lead-based paint. And then in addition to, it's combining the percentage of low-income households with children. And so what I do want to point out is that the central part and a majority of Santa Ana lies within that 90th to 80th percentile. And then as you move towards the very outer areas of the city, you are in about the 74th percentile. Next slide, please. So interestingly enough, as this was taking place with the city of Santa Ana, there was also last summer a publication that was made through University of California of Irvine Public Health, and they had partnered with Orange County Environmental Justice. And so what they wanted to look at, and this is their tagline, but it's Plono Santa Ana, which is kind of a play on words in Spanish for no lead. Plomo being lead, no lead. So, and they looked at the soil lead contamination and the spatial distribution of that throughout the city of Santa Ana. And lo and behold, what we're finding is this looks very similar to what was proposed out of the Cal EnviroScreen toolkit. And so what we're looking at is in red are going to be your highest levels per part per million, which is ranging upward of about 229.6 and greater in that quadrant. And then what they wanted to do was reach back to City of Santa Ana, knowing that SB 1000 is part of a proponent to change policy and to really find actionable changes that is going to reshape this community for the better. And so that then, advance next slide, please, is where Orange County Environmental Justice had not just collaborated with City of Santa Ana, but then City of Santa Ana reached out to Orange County Healthcare Agency and asked who would be, the most knowledgeable person or what group could help us with lead and soil. So now we bring in a childhood lead poisoning prevention program. And so there's 4 core actions that environmental justice wanted to take away from this process. And that was 1, to increase soil lead testing and further investigation and finding out causes or root causes of the soil having such high levels of lead in some communities, and then finding remediation. And this is really through identifying either ways to either remove the soil or to implement corrective actions so that it would be safe for communities. And what I did want to point out is that they did testing in a number of public spaces, but private as well, and near industry and at schools. And so the second action that they wanted to do was include or increase blood testing for lead poisoning. And this was for all community members. It wasn't just solely focused on children, although they did recognize children would benefit most from this because of their sensitivity from the ages of 0 to 6 years. And then also the third one was to improve tenant rights within the community, and the fourth was develop a healthcare action plan. Next slide, please. So this actually looks very similar to the mission of our Orange County Healthcare Agency. And so when they reached out, we had forged by that time, the first meeting was October of 2020. And it was very clear that we all had the same goals. We might arrive there at a different way or method, but at the end of the day, we all had the same goals in mind, and we couldn't do this without each other. And so this is where the Lead and Soil Roundtable was forged. We also wanted to find out how we could better serve these population groups within these census tracts and really promote the health and equity that needs to be in place. And so through that, it was really more of a preventive nature for moving forward. And there is going to be, I'm sure, as these actual items come to play, we'll have to come back to the table. So I did want to say that, we had met pretty much monthly, sometimes more often as needed to draft the policy general plan. And then there is a proponent where we're to continue to meet at least quarterly. So that's what will continue. Next slide. So what I want to, and for those that don't know, so every city has a general plan. The general plan provides long-term policy direction to guide the physical development of the community, quality life of those living within the community and visitors, economic health, and sustainability for that community. In particular, we're looking at the city of Santa Ana. Next slide. So if you recall, a component of this process, SB 1000, was to include feedback from the community and to loop in the community in the process to gain insight. And so what did happen was City of Santa Ana sent out a survey in those environmental or EJ communities, and there was a little over 1,600 residents that responded to this survey. And they really wanted to identify some key features of how this was going to shape or move the general plan forward based on what the community wanted. And so what I did want to point out is that 866 responders are exposed to excessive pollution from trucks, cars, and on a regular basis. This being that Santa Ana lies within major freeway systems on the northern and eastern borders of the city. And so you have, large corridors of industrial set up as well around those areas. And so, folks and pockets of people live within those communities. And then there was 732 that responded that they wanted nearby access to parks for their family. 686 respondents live, work, or recreate near sites where pollution by past industrial sites are, and live in homes constructed before 1978, where lead-based paint is a concern. The last was there's 376 respondents stated that they presently had mold or lead-based paint that they are aware of, and that their homes were in need of some sort of repair, which was concerning. So we really wanted to look at this and identify what were some of the actions that can be in place moving forward. Next slide. So with the general plan, I'm going to focus on the lead contamination actions, but there are many others. For the lead contamination action, what they really want to do is promote health. So by partnering with Orange County Healthcare Agency, they want to look at increasing blood lead testing, educational awareness, and soil remediation are the three core. Next slide. And so one of those proponents, as we know, is creating safe and sanitary housing. And so we understand, although this picture has a brand new construction build, that there's pockets of this, but the majority of Santa Ana does not look like this. The majority of Santa Ana has historic homes and homes that are within that older housing stock of pre-78. And so in order to do that, we want to make sure that they're addressing the deferred maintenance and lead hazards in pre-78 homes, that they're increasing community engagement, implementing a series of actions that reduces lead exposure in housing, and then also improving community health overall. Next slide. So now we're going to go into a series of policies and implementation actions that are currently now written into the Santa Ana draft. They're in their last leg of having a public comment. So it's already gone through review, but now it's going to go back to the city, and then it's going back to the city council. So hopefully, as we move forward and continue to meet, we'll start to see some of these elements and actions come into fruition. So the first, again, is just reiterating healthy homes, what that means for reducing health hazards associated with lead-based paint, of course, would be our forte, but also looking at asbestos, vermin, mold, VOC-laden materials, and prohibiting smoking in multifamily projects, as we are aware of secondhand, third-hand smoke, and lead concerns with that, amongst other things. And the second was rental rehabilitation. And so this is creating low interest loans for homeowners and rental property owners so that the homes can be made safe for the families that are living there, particularly low income. Next slide. And so the next policy with community element includes healthy neighborhood policy. And so this is really addressing for new construction coming in, public safety, land use conflicts that might be currently existing, hazardous soil contamination. Maybe there was a previous industrial site or some other activity that was taking place within that land, and maybe it's now needs to be cleaned or rectified before moving forward with a new build, and making sure there's identifying incompatible uses, and then also maintaining local building code standards. And the second implementation action down below under the community element includes rental property outreach. And so this goes back to kind of like what Tom was talking about earlier, but it's really having a proactive rental enforcement team that's able to recognize when they go into these rental units lead hazards, educating the renters of the rights and concerns regarding that, and really finding, okay, now we need to identify the property owners and have that corrected or abated. So it's including distributing that RRP element and lead safe work practices, and understanding that there's no repercussions or they're not going to be penalized, and that there's protections in place for reporting health and safety violations. Next slide. So the next implementation action under the community is environmental soil screening measures. And so this is really moving with stakeholders in HCA and Orange County Environmental Justice and UCI, and really digging deeper. There's a current study that's taking place at UCI with a group of 4 researchers, and we've been working with them. There's a request that came through, but it's really sharing information so that we can identify what are the root causes, and frankly, who would be responsible for cleaning or remediating. We also want to promote healthy outcomes related to lead contamination as recommended by health experts. So I know, like recently, there was CDC had just lowered their actionable level to 3.5 microgram per deciliter. So it's making sure that we're keeping up with the information coming in and addressing how this affects community members directly in their environment that they're in. And so next slide, please. The lead contamination and safety element, and this is a implementation action. So we want to work with local regional partners to understand prevalences and sources. Again, that's going back to the research and what's being implicated through that research. And then again, proposing solutions to remove the hazards and then finding finances to do that, right? So that might look like EPA grant or a HUD grant, and then ensuring that the money is spent in such a way so that it's improving those communities. It can also look in the form of a block grant or even through Orange County Environmental Justice, and there's grants available for folks on that side as well with education and outreach. And so we want to identify the benchmarks to measure and track effectiveness of these proposed programs as we move forward. Next slide. All right, couple more. So we have lead abatement, lead paint abatement. Again, this is coordinating with our building department and community organizations to strengthen local programs to eliminate lead-based paint hazards. We also want to give priority to those EJ communities in residential buildings within those areas. And the second part is this training for safe practices. So this conversation came out of, I know, not just some of the scope of work with EPA and RRP, but also amongst the local level as well. But again, it's not only educating and certifying the enforcement agency, but it also ties back into renovators and folks that are in construction industry, and looking at providing certifications for those folks as well to promote safe work practices and prevent lead contamination. Next slide. Okay, we're nearing the end, but we have a few more actions that we're going to make mention of, and those are renovations and lead prevention. And so this is just, again, increasing that contractor training, certification, and removal of lead-based paint to do so in a safe manner. But this is looking also at the plan submittal process and possibly producing like a stamp or a way of flagging those plans and providing materials back with the expectation that the general contractor will be responsible for ensuring lead safe work practices take place at that project. Next slide. Okay. Few other things in promoting health with partnering with local organizations, school districts, coalitions, and community health centers to increase blood testing, really getting the word out and making sure that the communities can find trust in the folks that are reaching out to them through a peer outreach model, and then really finding root causes of elevated blood lead levels and pushing that education out. Next slide. Okay, so this is again going back to finding federal investment and money to projects that reduce lead-based paint, and using the lead safe housing rule and focusing really on that ability to rehab communities and areas in EJ communities. We also want to look at collaborating with Cal EPA and identifying and creating, Santa Ana would want their own preventing lead poisoning education program within their community and city. Next slide. Okay, so public health outcomes. This is really just identifying and reducing blood lead levels is really what we want to target when we're talking about lead. And so that could come through policy change, wherein the city might lower, say, level of soil. Know that there's discussion of currently HUD holding or EPA holding at 400 parts per million in a play area, and for California and CLIP we use 1,000 for the drip line, but we're looking at, would it be feasible to lower that level through an ordinance or an action that the city council would approve within that city. And then the last part here is working with South Coast Air Quality Management District, and there's continued research going on right now. I know with roadways and different particulate, and identifying how that drift and how that travel of poor air quality could increase lead levels within soil. I think we're down to the last slide. So health conditions, again, this is just working with
sorry to interrupt, Jennifer. Would it be possible if we can just wrap up in a little bit, so that way we have time for the last presenter and some discussion as well? Just want to give a heads up. Thank you so much.
Yes, so this is the last slide. Yeah.
Perfect.
So
perfect.
Yeah,
Great. Thank you so much.
Collaborating with organizations to secure grant funding to, again, do more soil remediation, not just in residential properties, but other proximal sites that are near there with high soil levels. That's it. Thank you very much.
All right, thank you so much, Jennifer. So now we have a presentation from Karen Yu from the San Francisco CLIP. Please go ahead, Karen. Thank you so much. Yeah, we're not able to hear you, Karen. Do you have any trouble starting or need any assistance by any chance? I see mouse moving and clicking, but no, we're still not able to hear you. And I see that you're not muted either, so we should be able to hear you, but we are not. Yeah, so it looks like you don't have any audio.
Hi, Karen. You might want to have WebEx call you on your phone if you go to switch your audio. where the mute button is, there's a little arrow at the top.
Yeah.
And you can have WebEx call you.
Great. Yeah, she said, please wait. I think she's trying to do something. Thank you for your patience, everyone. And while we wait for Karen, like I said, we're just going to leave all the questions until the end so that way Karen has her time to finish her presentation. And I see that people are already typing their question in the chat, and I'll make sure to ask that at the end. And if you can put the presenter name next to your question too, so that way I know who to give the question to. Thank you so much.
Hello, can you hear me now?
Yes. Hi, Karen. Yes, we can hear you. Really great.
We want to thank Cynthia Melgoza, our health educator, for doing that. Anyway, so this is, I'm from the San Francisco Childhood Lead Poisoning Prevention Program, and today I'll just give you an overview of what prevention work we've been doing for the last 30 years. Next slide, please. Next slide, please. Okay, thank you. So basically our prevention work started in 1992, as early as 1992, when the city passed an ordinance called the Comprehensive Lead Poisoning Prevention Ordinance, where there were several mandated prevention activities. In addition to giving the city the authority to investigate lead poisoning and to write property owners notices to correct hazards, education and outreach to certain agencies such as Head Start and other child care providers were mandated, and that helped us establish relationships that are still a part of our network of partners today. And the ordinance also required environmental investigation activities. For example, we were asked to identify high-risk areas in the city, and once we had done that, the city departments were then directed to put their resources into these priority areas in terms of education or screening or lead hazard reduction efforts. And another activity we were mandated to do was to identify empty sites where we were asked to test non-housing sites that were not occupied by housing. For example, like just an abandoned lot. We were given the authority to go assess those property and then find the property owner and then talk to them and require them to have remediation. So the last thing was, right, okay, so then in 1998, before 1998, the city used to receive many, many complaints about sandblasting or some kind of paint work outside. And as you can imagine, there was a lot of dust, contaminated neighboring sites. So in 1998, the San Francisco CLIP also drafted an ordinance that prevent painting work, dust, and debris from migrating to neighboring properties. So this was even before Title 17. San Francisco already required that exterior work on pre-1979 buildings and streets pre-1979 buildings and steel structures, that anytime they do paint disturbing work, they have to have containment, and we prohibited certain work practices such as burning and dry sanding. I guess this was a huge move for San Francisco because the ordinance created a cultural change. And it was a very visible culture change because all the netting and the containment started appearing in the city. And so people were learning even in that way about lead and lead hazards and how to manage lead-based paint properly. Then in 2001, the health department declared lead hazards as a public health nuisance. and in doing so gave us a very simple but powerful investigation and enforcement tool to do our work. And then we're going to take a look at that in detail in the next slide. But then in 2004, the building department ordinance that requires containment for the exterior work was then extended to containing any paint disturbing work that would occur on the inside. Okay, next slide, please. Next slide, please. Thank you. So just a brief overview of the public health nuisance. So basically, the health department declares that lead hazards are public health nuisances. And this is significant because it was a policy change that made lead hazard a housing issue rather than just a response to an illness. It made it a housing habitability issue. And this is key in San Francisco because 90% of the housing in San Francisco was built before 1979. And so this public health declaration is, it is tied to the presence of children under 6 in order to enforce this nuisance code. But the nuisance code provided us with the ability to visit any home with a child, to do education, and then to do an environmental investigation. In addition, since most of the buildings would contain lead in San Francisco, the paint in the building was presumed to be lead-based paint, which eliminated our need to do the testing, the paint testing, and then any deteriorated paint in the pre-1970 house, we would just declare as a lead paint hazard. And then we would continue, we continue to do dust and soil testing. And so then a notice of violation can be written to property owners to correct any deteriorated paint conditions that contaminate dust and like contaminated soil. And so San Francisco has been using this nuisance code for the last 30 years to do our investigation work. Okay, next slide. So we can do inspections, but we have to find the properties. And so we make use of our extensive network of partnering agencies, which is really the foundation, you know, our health educator provided the foundation for our 30 years of prevention work. So these are some of the organizations that we've been partnering with all these years. So a lot of them are health agencies, and we try to increase the likelihood. So basically, we were asking these health agencies to make referrals to us. So in order to increase the likelihood that these agencies would make a referral to us, we began offering a more holistic environmental assessment program, especially in the area of asthma triggers, identification, and elimination. And so that's because more families were concerned more about cockroaches, rodents, and mold than lead. They know very little about lead. They know more about cockroaches and rodents. So once we're inside the unit to investigate these asthma triggers, we evaluated for lead hazards and other health and safety issues, such as, you know, the absence of functioning smoke detectors. And our health educators also assess the social determinants of health. And, but in addition to waiting for referrals, we also actively seek avenues to address lead hazards. For example, we do something called exterior scans by census tracts, which means we would walk the neighborhoods, identify buildings with deteriorated paint that's accessible to children, and then we would connect with the property owners through a notice of violation. And in addition, we would leave like door hangers on the properties, notifying that we have noticed some lead hazards on the outside, and ask them to call us to invite us to the inside for an investigation of interior lead hazards. Okay, next slide. This just shows a referral form to our different agencies that we're partnering with. Notice where the red arrow is, and that points specifically to lead, but we also let them identify for us other health hazards that they're concerned about, such as bed bugs or mold. Okay, next slide. And this basically shows the circumstances under which we provide the different types of environmental surfaces. So we actually go into situations where they're just pregnant women and they're about to give birth. And so in those situations, we would just do a visual paint evaluation, and then we would do dust and soil samples. And if we notice that they also have non-housing samples such as spices, we will also talk to them about it, and we might take a sample and do an XRF screen. And then we also received many phone calls from concerned families with children under 6, where there aren't any blood lead levels yet. And we would basically go into those homes and do the same type of, provide the same type of environmental surfaces. And then we've been doing home visits for blood lead levels less than 4.5 micrograms per deciliter for many years. And again, in there, we would just do the visual paint with the dust and the soil and then the housing samples. And then you probably know about the rest, where we do basically full environmental investigation with our XRF, paint, dust, and soil and water. Okay, next slide, please. This is basically showed, this is the year before COVID hit us, and it basically showed where we went for and provided environmental services. So over 61% were non-blood lead related, and only 39 involved knowing the blood lead level. So next slide. And this shows where the 39% with blood lead level, but even then you can see the blood lead levels are really, the majority of the blood lead levels were really low, so we mainly went into the majority of our environmental investigations were conducted in homes with very low blood lead levels. Okay, next. Now, I think that provides a quick overview of what we've been doing. So thank you very much. And if you have any questions, I'll be here to answer. Thank you.
Thank you so much, Karen. And I realize that it's now a little bit after 11 already. So thank you for your time. I just want to quickly say thank you to the presenter for their time to put together a presentation and provide the presentation to us. So we'll just quickly go to question here. I know Michelle posed a question for Tom, I think, in the beginning. And she asked, was the training required for inspector, and was there any resistance? Thank you for all the accolades to the presenter. Tom, are you still there?
Yeah, sure I am. There was actually, no, there wasn't resistance at all. In fact, they bought in 100%. It was a surprisingly great collaborative process. And I gave the training to them, the 3-hour CEU training. They're asking questions along the way. You know, we showed them all about lead. They actually were really engaged, and we did some things. We provided like the lead swabs, and we showed them that, and then we did like a Jeopardy quiz with it, and you know, just some fun things. And these people were involved. There was zero resistance from the housing inspectors.
Great to hear that. That's actually segue really great into another question, which was asking about the housing inspector letter when it's course approved for, you know, for the credit, and because you said that you provide the CEU to them. So do you have any recommendation for others who want to seek to pursue this process?
I'm sorry. If the question was directed to me, yeah, I think all of us could probably design a pretty good lead awareness training for them. Certainly, it was. I went through Los Angeles County's environmental health to get my program approved, but it was geared specifically for these inspectors.
Oh, great. So I have another question, and this is for Jennifer. Do you have any recommendation for establishing lead hazard code citation within Santa Ana proactive rental enforcement team for other jurisdictions?
To make sure I understand the question correctly, do I have any recommendations for enforcing the Title 17 code, or are you talking about a local municipal code?
It said here establishing lead hazard code for proactive rental enforcement.
Okay, so what, two things. So first of all, City of Santa Ana does have their own rental inspection team. And so there is discussion currently on the table about setting up a team meeting with them to provide additional training. So Tom, I'll probably be reaching out to you to maybe pick your brain about that. And they are looking at becoming certified with like an RRP and, like you said, identifying lead hazards in a home visually. And then they can enforce that through Title 17. It used to be SB 460. That's now chaptered. So anybody in California that's enforcing that through either a code enforcement or even through CLIP, lead hazard reduction, can do that under Tier 3. So yes, we will be collaborating our efforts so that there's no duplicate efforts, I should say, but working together on that. Does that answer your question?
Yeah, thank you, Jennifer. And I have a question for Karen. What suggestion do you have for maintaining strong partnership with local community partners who provide family referral for environmental investigation?
Yeah, I think that our health educators are on, they're connecting with their partners continually. So it's a mutual partnership, right? We attend their affair, their health fairs or their meetings. And then, yeah, so there's a continual, it's ongoing and it's, yeah. So I think that's one of the ways that our health educators built that relationship and sustained that relationship. Mm-hmm. It has to be a mutual, give and take. Like, for example, David was mentioning that he's on one of their boards or their committees that has to do with health and safety, I think. So it's a mutual give and take.
Yeah, for sure. Thank you for that. Do we have any more questions for our three fantastic presenters? Someone was asking, Michelle had to leave early, and she said that she would like to have access to these slides. And like I said in the beginning, you will have that available to you. And our host also asked us to please kindly fill out a follow-up survey. So I'll be sending out that link in the chat for you. If you can just take a minute to fill that out right before you're done here, that would be really great. That would really help us to plan our future webinar and session like these. All right, so it's almost 11:10, so that went over 10 minutes. So thank you so much for the presentation, Tom, Jennifer, and Karen, and thank you for the attendee who stay a little bit after, so that we can have a little bit of the Q&A session. I hope you have a good rest of your Friday and a really good and restful upcoming weekend. Thank you, everyone.
Thank you.
Thank you. Bye-bye.